Hi, Leanne. How are you today?
Hi, I'm well, thank you, Karen.
Hi, it's a good opportunity just to catch up with you and just to get some insights as to your experiences as being a clinician within COVID-19 and just to get an understanding of what you've noticed. So if you don't mind just introducing yourself and then we can just go from there.
My name is Leanne. I'm currently a resident at Prince of Wales Hospital. I'm right now on my ICU rotation.
Great, great. And so what are some of the things that you've been noticing?
Well, during the pandemic, I was in the emergency department, which was kind of the front line of this whole thing. And it was very interesting to see things evolve. It was just so much uncertainty, so much fear and anxiety. And it was very difficult to kind of distinguish what was panic versus what was a kind of like a necessary caution to take. Um, and so I think that I've really been actually have I've been very heartened by the positive leadership examples that I've witnessed.
Okay, okay. So what are some examples? What have you thinking, oh, that was great and I'm going to take that with me?
Yeah. So I have seen specifically really positive kind of on different levels as well. So um, in a on a local level or on a small scale, I've seen kind of seniors reach out to juniors and check in on us and acknowledge kind of the difficulties at this time. Um, and yeah, making sure that there's a safe space for us to turn to. And then on a higher level, kind of a more systems based perspective, I've also noticed really strong leadership from the emergency department and then as a hospital as a whole. So, for example, the emergency department I know really advocated for every single staff member to have enough PPE and everybody wear surgical masks, particularly in the early stages when numbers were rising and we didn't know what was happening. And we had a limited understanding of kind of the just even the pathophysiology and the progression of the disease. And I was really heartened by um, by the priority of staff welfare. And then on a kind of even more than that is I've noticed that our hospital in particular um, kind of tailored their approach to JMO rotations specifically to our needs, and there was a kind of a general recommendation by the ministry to freeze rotations. However, I found that from our senior executives, just by listening and gauging the temperature of the situation for our hospital, they made decisions which was in our best interest. And I think that um, I really appreciated that. And I think that definitely raises my morale and makes me inspired to become, to bring like, um, yeah, to be a better worker and to um, be really proud to work for the hospital that I'm in because I felt cared for and valued. Um, yeah.
And from our times together, you mentioned you also had to make some personal changes as far as, during this time, and it's had
Mm.
impact both out of work from a social and personal. What are some of the things that you've learnt around that about yourself and about your ability to adapt?
Mm. Yeah, definitely. I think it's interesting to recognize that leadership isn't, it doesn't have to be this formalized process, and we can carry elements of um, these qualities in leaders that we see in our day to day as well. I think that I've really been inspired to um, be more accountable for my actions as well. And being in the hospital, um, so I want to set an example and follow social distancing guidelines. Um, and I want to have ensure the safety of my patients as well. And by doing so, that would mean minimizing my exposure. So I think that it is interesting because it's a job, but it's also it carries implications outside, yeah, into your personal life. Um, but I think that it's really important, and I think that um, yeah, I don't know. I guess it you bring your whole self to work, and so yeah, it's important to remember that. Yeah.
So Leanne and I have been working together with as part of the Clinical Excellence Commission in regard to the ISQA Fellowship Program for Quality and Safety. And so we've touched base virtually on and off. So 2 weeks we've had modules that we've worked through together. So some of those modules have been about leading quality and safety and thinking around from the patient's perspective and parts from there. So what have you noticed around working with patients and carers and families? Have you seen anything from a leadership perspective there?
Yes, I think I've been in I've been able to sit in on a few very difficult family meetings, particularly in the ICU, where there are some very heavy discussions. And I've seen that um, the best leaders are the ones that are very empathetic, and also informative and provide kind of clear, yeah, very transparent. And those are, yeah, and a priority on having a common goal and remembering that we are all in the same boat and we're all working towards the same things. Um, yeah.
Great. So in finishing up, is there anything else that you felt you'd like to share through this conversation?
Yeah, I think that going forward, I have learnt to the first important thing is to collect data, engage the environment of where you're in, listen to your staff, and kind of seek out feedback, even if it may be challenging and critical. And then, so particularly in times of uncertainty, there's an opportunity for leadership anywhere. So remembering that, having a clear vision and mission to try to, yeah, have some direction and work as a team. And then also just being adaptable, like always retriaging your priorities and kind of, again, that ties in with the feedback thing. I guess that's just going back to step one and remembering that it's an ongoing process of getting feedback and adapting. Yeah, I found that personally, being around very inspiring leaders has really made my day much better. And so it's something to inspire towards.
Great. Thanks, Leanne. I know you're on night shift and I really
No, it's okay.
really appreciate you making this time, and it's been wonderful to talk to you. All right.
Thanks,
Thank
Karen.
you. Okay, bye-bye.